for Center Vermont, recording progress. And I have been here for 22 years, but been in the field longer than that, probably about 30 years at this point, working at Head Start, at private licensed childcare programs, parent-child centers. That was where I've been for a significant amount of time. And I'm excited and honored to be here today. Thank you.
Yeah, thanks. And I'm Chloe Leary. I'm the Executive Director at the Winston Prouty Center in Brattleboro. And we have an early learning center and do children's integrated services and some other programs. I've been here 15 years and also really excited to be here. I'm a big supporter of CIS, and I really like sharing it with people and helping people know why it's so important. So thanks for taking time to be here.
All right, we're going to dive right in.
Hold on just a second. Let me get to this. There we go. So I'm going to start us off. For those of you who don't know anything about CIS, it is actually something pretty unique in the country. We get lots of feedback that we're doing something innovative that other states look to us to try to figure out how to do. Like, how did you do this thing to make it easier for families with young children to access services in a way that that is less burdensome. So what is exciting, I think, about this model is that it's really integrated in the sense that the back end is working all together so that when families with young children come and are seeking supports, there's sort of no wrong door, essentially, that will bring them into a group of people who are working together in an integrated way, so that it's not just, yes, everybody knows who's working with me, but really one team supporting families and kids. And I'm sure many of you experienced this and maybe still do. I mean, I think this is a aspirational, like we're continually trying to improve this, but rather than families having to go to multiple providers and tell their story over and over again and try to figure out which service they might need, I think the goal behind CIS, and I think what we've really come to do in these past several years, is to make it easier for them to access the system of care and supports so that they get what they need to help their child develop as best as possible. Just to point out, if we're, the data part of it and figuring out what's happening for kids and families, and certainly I think we've gotten a lot better at this in early childhood in general. A shout out to BBF on that front too, like trying to figure out how kids and families are doing. This kind of integrated service helps with that too. So, there are 0 to 3 had an article about CIS and just pointing out how innovative it was. The Center for Healthcare Strategies, there have definitely been national recognition. I think a lot of people don't know that. We take it for granted that we're doing something pretty unique here. So, so that's a really broad overview. Any questions? I'm not sure I can see the chat the same way, or hands. Raise your hand or speak up.
Yeah, I'm not seeing any questions yet in the chat bar, but folks know that's an option as well as raised hand, and Chloe and I will alternate with monitoring the chat.
Great. All right.
So this graphic, and I think we should also do a shout out to Courtney Farrell at Lund. We are piggybacking on her awesome slide deck here. So thank you, Courtney and Margaret Atkinson, last year's presenters on this issue session. So this is a graphic that represents the services that braided together or bundled together in each region of the state comprise CIS, Children's Integrated Services. So early intervention, actually at the center of it, you can see that gray rectangle, which is service coordination, which is kind of at the heart of what Chloe just talked about, which makes it unique, is kind of, we have a front-facing door with families that we hope to be integrated and more seamless, no wrong door, but behind the scenes are the colored partners sitting at the table and coordinating in the back end, so families have more of a friendly, family-friendly experience, and we're there at the center of the table, ideally, in terms of determining unique services for them and their family, their children. So early intervention, which is also known as Part C, it's birth through 3 special education services provided federally funded across the state. Eligibility is a developmental or delay that's diagnosed with an assessment and screening process. Service referrals come through a lot of venues, pediatricians, community partners, DCF, parents can self-refer, school districts, et cetera. Services are uniquely tailored to that child's development or that family, those family goals. And children age out, they transition at age 3. Either services are no longer deemed to qualify to, or they do qualify in terms of getting special ed services in their public preschool programs across the state. You've got early childhood and family mental health. Those are partnerships with designated agencies across the state for children birth through 5. Well, families primarily are the target population, but children get therapeutic services, and they're delivered primarily home-based or some in childcare programs themselves. And again, similar service referrals, DCF, community partners, childcare programs that are looking for extra supports and eyes on families that are needing therapeutic supports for their child. Over here in the green, we've got Strong Families Vermont home visiting. Those are primarily delivered by 2 different buckets of service providers. Strong Families Vermont home family support home visiting, parent-child centers, and some other partners. I'm looking to Winston, Prouty as well, but primarily parent-child centers deliver Strong Families Vermont home visiting services, of which many use parents as teachers, the PAT, which is a nationally validated and accredited service delivery model, evidence-based. There's all these jargon words, evidence-based. And then you've got Strong Families Nursing home visiting, which is delivered by the nursing, the VNAs across the state, different home health partnerships that have nursing at the table. Specialized childcare, which is the top yellow, that is a unique, I think, component of children's integrated services, which helps really bring in the childcare support component. So we've got families that are in DCF, family services involvement, custody, foster families that have children in a place with them. And if they need childcare, there's a childcare, specialized childcare coordinator in each district across the state that helps bridge, navigate that bridge between family service workers, referrals, onboarding childcare providers to be specialized childcare and to get the training and certifications that they need, and to support children's being successful in specialized childcare placement. This is a vulnerable population. A lot of the CIS customers, clients, families, children are vulnerable populations, and so we're proud as a state of Vermont to have something that kind of handles this group of young folks with care. To look towards early intervention as being a solution to higher taxpayer costs down the road. And I'll be quiet. What are some questions? Again, Chloe will talk next about that kind of gray bubble in the middle. What does service coordination look like across the state?
Yeah, so first I just want to talk about what does CIS look like at a systems level. And I think one of the other unique aspects that I want to point out is it's also a partnership with the state. Right, so the state of Vermont has a responsibility, or has taken a responsibility, to support our children growing and being supported to develop optimally. And so, they do that by contracting with private organizations in the community to carry out the support. So there is a state team that has direct contact with each region and supports each region and helps with oversight around how services are delivered. In each region, there is one fiscal agent that has taken on the responsibility to make sure that the office functions or the billing functions and all the coordination and bringing people together is happening. And then via contract, there is a regional, we call it a systems team in our community, but an administrative team that is sort of the stakeholders that are holding the services. So in some regions, I'm realizing this is pretty high level. In some regions, there might be one agency that provides the bulk of the services. In other regions, there might be subcontracts. And as Claire mentioned, for instance, the DAs, the designated agencies, often are providing early childhood family mental health. So there's a team of people, both state and local organizations that sort of oversee what's happening in the region. Every region has a coordinator. So one person who's responsible for, again, handling the logistics and operations, I would say, of CIS. And they coordinate and pull together the weekly teams that's sort of bringing all the service providers together regularly to talk about caseload, who's supporting what's happening, and making sure that that integration is really happening. Again, it's not sitting down and saying, I'm doing this, you're doing that. It's more, how are we holding this family and these kids, and what makes the most sense at this point. So it's the whole structure really works together and creating communication around how are we functioning. And that's, I think, another strength of the region. I want to point out that every region is a little bit different, and this can be a strength and maybe sometimes a challenge. So for instance, there are 2 regions in our state that do integrating family services. So they've sort of taken the whole, the lifespan up to 21 and tried to do some integrating across a larger life age range. So there are some differences, and wherever you are in your community, figuring out who the fiscal agent is and who the coordinator is can be sort of the access point to figuring out what's happening in my community around CIS and who's holding, who's the glue providing the sort of bringing everybody together. So that is an overview of what the system sort of looks like in structure, again, with the caveat that every region is a little different. So any questions on that? I can't see anybody because I'm sharing my screen, so I'm going to rely on anybody else to let me know if they see any questions. All right. I'm going to try to get to the next slide. There we go.
Awesome. So we've talked about the overview of the CIS services, and this is a little bit about why it matters. Prevention and early intervention, as we all know, I mean, I'm looking through the list of participants. There's a lot of folks that have been around the block, and you actually have the role. You're a developmental educator, or you're a CIS coordinator, or a child care coordinator in your region, or you work in CIS in the state of Vermont. So prevention matters. There is research about this. There is lots of studies that identify that prevention and early intervention do make a difference in the lives of families and children, that there are long-term benefits from catching and supporting and identifying, putting services in place early on to get away from a crisis point and to try and bring a family that's held through CIS services to bring them back to some sort of point of stasis where there is more stability in place. So this impacts whole families. It impacts children's social and emotional health, as well as the families, the preservation of families, and potentially, hopefully keeping families intact, as well as looking towards stability, family stability. A lot of this, the work that case managers do is also just along lines of being kind of that safety net for each family. The primary service provider is the one that has a relationship and there's continuity. They work towards family strengths-based one-plan goals and goal setting that help families succeed and children succeed. Putting specialists, getting specialists in place at the table, supporting, there's this blurb here around supporting parents in the workforce. I mean, COVID's just thrown that out the window in terms of parents being able to consistently work daily given healthcare challenges, especially young population that's not vaccinated, and illness kind of kicks them in and out of childcare on a daily basis. So these are some of the real reasons why this matters. And in terms of looking at complementary support connections with DCF and family services, as well as economic services, reach up and helping families move towards economic, success and self-sufficiency. CIS works hand in hand with those systems Often DCF, Family Services, is at the table across the state, and Reach Up as well. It does look different. Chloe said that it looks different, but the that underlying connection is key, and it's in place. Looking at K through 12, everyone knows that costs just are, exploding each decade in terms of special ed costs and the burden placed upon public schools, K through 12. And so yeah, CIS makes a huge impact on that. We see it all the time in our regions, children that they're closing out. The goals have been achieved in a one plan. Families are closing out, having achieved their one plan goals, and so there is some real economic and, more importantly, cognitive, social, emotional gains by having the system in place. Questions, comments? There's a question right here, Chloe, actually.
Okay, good.
Do you see it? Do you want me to read it?
Yeah, I can't. Well, I guess I can look in the.
As a beginner's question, as a new preschool teacher, are children's integrated services, are they available to any, it's a great question. Are they available to any family in Vermont, and what's the way to access them? Do you want to take that, Chloe, or do you want me to?
Yeah. Yeah, any family in Vermont can access this service, and they come lots of ways. Pediatrician, the WIC office, Claire, I think mentioned a few, that there are, again, no wrong door. Wherever families with young kids are, hopefully somebody can help them connect to children's integrated services. And what I always say is, if CIS isn't the right thing, I hope we can help you find the right thing, that we're here to really make sure that families with young kids get what they need, wherever that happens to be, whether it's CIS or somewhere else. So anybody can access it. I think it is, this is maybe more in the weeds than you want to know. It's a combination of Medicaid funding and state funding. And so, in terms of thinking about funding structures and that sort of thing, we'll talk about that a little bit. That is the majority of funding comes through Medicaid, and we need to make sure that population gets services first, just to say. So being really clear that we try to help all families, and we understand that the primary benefit is, really the focus on helping families who might struggle more is really important.
And I think to add to that, Chloe, not all CIS referrals are open to all families, and not all families are deemed eligible. And so that's where the last part of what Chloe said is really important. It doesn't mean if a parent has reached out, or if there's a contact or referral made, they all have to be made with parental consent. So if there's a referral made and they're deemed not eligible, whether it's early intervention or with Strong Families Vermont, there is a Medicaid eligibility component. Part of the beauty, which I hope is intact across the state, and I think it is, once that referral is made, the CIS team will find another way to reach out, to support, and to keep some sort of continuity in place with that family. And that is the hope with the no wrong door.
And I see another question: how can we expand capacity when CIS is impacted to the point that services are not easily accessed? And I'm not sure if you mean not easily accessed because there's not enough staff, or I'm not sure if there's, there are lots of ways that CIS is impacted, and there are challenges to presenting. So,
and we do get to that. That's coming right up in terms of where there's a bottleneck in the system.
And just not enough to go around, right? And so that's part of why you're here, right? How do we advocate and let people know how important this is? And therefore, how do we help our state continue investing in something that's making a big difference? So I do think there are differences too in parts of the state, right? The more rural parts of the state, as usual, have a harder time sometimes accessing services. So even though I know we're overall a rural state, there are definitely challenges region by region. So we talked a little bit about this already, but highlighting the point of intentionally trying to be more upstream, so we know that if we get in early, we can have better outcomes later on. And CIS really holding the whole family. I think that that's another strength of the model. some of you may have heard me say in other workshops and places, like, please don't get into early childhood because you like kids. You got to like the families too, because really holding the whole family and understanding that multi-generational approach is important if we're really gonna leverage the most from this program and this model. So and Claire talked a little bit about the value of it in terms of actual numbers and economic, which I don't think we'd like to talk about that in the sense of, because it's really just the right thing to do, right? Let's support kids' development. Isn't that the right thing to do? It is the right thing to do, and it just so happens that it pays really well in the long run. So ROI, return on investment, for high quality early childhood services, 13%, which is, if you think about, maybe you have a checking account that gets 0.5% a year on return. This is a really big deal. And that work, just to point out, comes from James Heckman. Some of you are familiar with his modeling around early childhood. So it's the right thing to do. And it's advantageous for folks who don't want to make the investment. It's actually a good investment. And Claire also talked a little bit about, bringing in evidence-based practices. And again, what I love about CIS is doing it in a unique way. So parents as teachers as an evidence-based home visiting model works for some families and not so much for other families. So we have other tools in our toolkit, also evidence-based, that help us really meet families where they are. So, bringing in, and it's not just it's sort of having a toolkit at the ready that's based in good practices. So strong families, the nursing component is based on MESH, which is maternal early childhood sustained home visiting. Touch points is actually an evidence-based model of how to work with families. It's a relational model. It's not a service model, but still, these are some of the tools that we bring in to really address and mitigate, the sort of multi-generational trauma, ACEs, and other what we know are challenges that families face and barriers to helping parents and families be and do the best they can be. So Touchpoint says parents are are one of the experts on their child, and how do we help them really do that, because they really want to do the right thing, and CIS really helps us accomplish that goal. So.
And there's a comment there, clearly the pandemic, we're all seeing the impacts 2 years now as we hit mid-March. We're seeing increases in referrals where speech and language is significantly impacted, as well as obviously within the family services system and children that, increases cases that are being opened across our state. So yeah, we're really glad CIS is here as well.
Yeah. Great.
And yes, there is a website. We can take turns, but it's a CDD website, and we can put that link, drop that in the chat. Child Development Division, State of Vermont. So why is integration important, right? We all know that. I think I love Chloe's comment around don't go into the field just because you like kids. You need to really love family work. And so part of, I feel the same way around working in systems. It's coordination, and it's partnership, and it's integration. And if we can make it easier for families, I know that there has been a history of families confused as to who's visiting on what day, what the service provider's name is, what hat do they wear, what agency are they from. So the ease of service access for families and having there be consistency, you see in these bullet points in terms of integrated plans of care, that can be so confusing for families, especially if it's their first child or not. But parenting young children is hard, period. And so having services come into your home and keeping track of them, or different one plans, or having different individual service plans. So we're reducing duplication, contradictory messages, making it easier for families, having there be a consistent presence or friendly face that they can trust and build a relationship with. It also an ease of referral. So we talked about having a CIS coordinator, have that be the conduit for referrals in each district. I think it's a huge streamlining, which benefits. There's weekly referral meetings that happens. There's just timely dissemination. There's data on timeliness that we can track. So we talked about ease of service, ease of referrals, integrated plans, the availability of data. Data is huge. You know, we're in a data-driven society, and social services is slow on that uptake. You know, parent-child centers a lot slower, I think. But we're there. Data is what tells the story, period. And having CIS be in place for 11, going on 12 years, if it started in 2009, we have now data, statewide data, year after year. So we have trend lines, and we can track them. We can advocate for referrals, what the types of referrals, how many of them are opened or closed, timeliness, qualitative and quantitative data. So it's pretty outstanding to have data in place and being gathered. Integrated funding makes a huge difference. It's more seamless for communities to have the conversations and set priorities, as opposed to kind of competing individually for separate contracts with DMH, you know, DCF, CDD, Department of Health, and having case rates in place and having bundled contracts. And that also supports regional decision-making, which I think as community partner agency, that's a passion of mine and Chloe's, in terms of regions are different, region to region, and having an ability to individually prioritize and have those dialogues reflect what your community needs. There's something really powerful and important to that. Thoughts or questions?
Great.
Thanks for dropping that chat. I mean, the link, the website link in the chat.
So I'm going to try to explain this in a way that makes sense to folks. CIS is essentially managed care. So every region, and it was based on historical funding for these different programs, got put into a bundle. And that bundle was distributed into the region when we moved to CIS, distributed based on sort of the caseload count. It was a per member per month fee. And so when you see a range, it was essentially taking, so the case rate of 498 to 854 there in the second bullet. Wow, that's a big difference. And does it really cost something different in each region? So this is actually some of the work that was done. There's been some, you know, this is not the case anymore, but it was essentially a way to just draw down the contract amount. So and I wish this slide talked a little bit more. I'm just realizing, sorry, I'm just going to riff a little bit. What's to go off Claire's point of the reason this allows for local funding, for local decision making, is because it's not a contract per service. It's a contract for the region. We get to look at the needs in our region and say, wow, what's happening right now? So if suddenly there's a bunch of new need, like as we expect from the pandemic, maybe a bunch of kids are going to start having developmental delays because they were isolated at home and not around peers. So suddenly early intervention is seeing an onslaught. We can shift resources based on our regional conversation, our observations, and our data to say, wow, we better put some more to early intervention so we can meet that need. It might mean that and hopefully there's something else that's, we're not, you know, robbing Peter to pay Paul, but hopefully we can sort of look at that allocation and look at our regional needs and meet what's happening in the moment and be flexible around it. So I can't remember if we end up talking, but I just want to note that the case rate is now standardized, and we will talk about that a little later. So we have made progress on that front, but yeah, hopefully that helps explain how CIS is funded. Are there questions? Sometimes questions help make it more clear.
Chloe, you'll probably clear this up. I'm wondering in terms of what the legislative financial ask and how that's going to affect these numbers.
Yeah.
Okay, that's what I thought. I just wanted to make sure.
Yeah, thank you. And these numbers are old. Like this is where we were, and we've made progress. So thank you.
Definitely.
Yeah, we're getting there. This is where we jumpstart to the now. So that's a lot of history, and for some folks that this is old news, we apologize, but it's really important to give the foundational kind of overview. So here we are. advocates are here today wanting to learn more about ways that they can ask legislators to make priorities in this legislative session. CIS funding challenges have been historic. So starting in 2009, there was level funding in place until last year. In 2001, CIS, yay, received its first increase in funding, and the case rate went to $600 across the state. So payment reform happened, contracts were put into place. Some regions were up, some regions were down. There was a period of time to transition regions. I think 18-month contracts were in place to give regions an opportunity to make those decisions. And then the level playing field is kind of, we hit the starting point in 2001. So we are all receiving the same case rate, not the same amount of money per region. Obviously, there's other factors that determine how much each region has and how many cases, families each region bills for. But so yay, that's great news. And a lot of this, the success for that increase was a result of advocates like yourselves, people advocating that this is important, it's critical, it's underfunded, the system is stretched, it's bottlenecked, we can't keep staff, there's a revolving door we need very high qualified specialists in a number of these positions, and there's a lack of capacity to meet the needs across the state. So yay for the first bullet. The second bullet is still in place. We still, across the state, are experiencing a critical lack of capacity to serve children and families that are struggling now with, add a pandemic on top of these bullets, including child welfare, state involvement with DCF, exposure to opiates, that's through the roof. People have heard about opioid deaths being unprecedented in terms of last year, and who knows what 2022 will be like. Poverty, homelessness, again, unprecedented rates, numbers of families that are living in motels across the state is a significant hit. There's an increase in referrals, autism, as well as a number of speech and language referrals. There's a trend line that's really just going up and up. And so we have, yay, an increase in our case rate, but B, the second bullet underscores the story that there's not enough funding. There is insufficient funding in the system currently to support the needs across the state. There's another, a third bullet here that's kind of in tandem to that. And many of us that actually have been working in these positions or in this field for a while know that there's a chronic conversation around the need for a CIS database. The state has explored, different leadership has explored different opportunities at the time. We've been around and seen some things go farther than others in terms of being able to pilot something. And to date, there still is not a CIS database that is owned and operated by the state for CIS services. So that's a big gap. It's pretty significant, the amount of data that needs to be tracked and reported to the feds and the state in any one of these services. So that's something that we're advocating for actively this session as well, because there's an opportunity in place to have a community database that the Family Center of Washington County has implemented on the Salesforce platform. Chloe, I think Springfield, a number of other parent-child centers and CIS fiscal agents are exploring using this database, and it's an opportunity for us to take the conversation next level to the legislature to get some funding, one-time funding approved to support a really, really, really sorely needed database for this system.
Yes. And to the point of somebody asked about in the chat about unfilled positions, just like every other sector, for sure, everybody's suffering from hiring, but just to point out that staffing shortages and filling some of the specialized positions and early intervention are, I think even in case management, nursing, it is really hard. And that is one of the impacts of resource challenges. It's hard to compete for staff when you can't pay as much as other positions. So, you know, I think that that's definitely one of the impact in terms of capacity. And I think my takeaway from this slide is really what ends up happening when a system is under-resourced is that it's not functioning the way it should be functioning. So if we're in crisis reactive mode all the time, we aren't getting to the upstream support, which is really the full promise of CIS. Is if we get in there early, you know, all that we all know, like brain development and getting in there 0 to 3, super important. And if we can't get there, if we're always being reactive, we're not actually living the full promise of CIS. So I think this lack of resources fundamentally impacts the ability of the system to function optimally, and therefore, you know, impacts kids and families. And we aren't going to, you know, reap the rewards and benefits of it. So that's my takeaway there. I'm going to keep us moving, just looking at the time. So Claire, what's the ask?
So this is it right here. There's 2 bullets. Statewide CIS budget increase in the amount of 1.8 million. It's an investment which would meet the cost of care and ensure continued progress in the family safety, stability, healthy child development, and young children's access to quality early care and education. We've had some great success so far. I think that's in the next slide. But House Human Services will update you. The conversation is where that is in terms of the budget memo. I mean, the memo that came out of committee to House Appropriations. But we're actively encouraging, asking you to encourage legislators to support the funding increase for FY23 for CIS, reaching out to legislators, emphasizing the importance of this comprehensive system. As Chloe said, it's nationally recognized, it's innovative, it's working, and that's underfunded. It's working. Imagine its potential if it was sufficiently funded. And the one-time investment, which I had mentioned briefly, there's ARPA funds on the table that everyone's kind of competing for in the Commerce and Human Services world, and the request is for 1.6 million to build out a statewide CIS data reporting platform. So this final slide is really just a dialogue. Here you are, you can see that the House Human Services Committee did recommend in their memo to appropriations an increase in the case rate from 600 to 650. It's not as much as we asked. We were asking for 700, but it's something.
And just to say, let me jump in, Claire, there's actually data tied to these numbers. So there was a study done in 2018, I've lost track of time, but a case rate study that showed that it should have been $634 a case. That's when they bumped it up to 600. So given sort of inflation and where we are now, several years later, it's closer to 700 at this point. And so we were asking for 700. That's how we got to the 1.8. So the House Human Services is giving half essentially of what we were asking for. That's where those numbers come from.
That's great. So that would comprise 880,000 of annual funding that would go into the CIS bucket. That would be apportioned across CIS services across the state. Again, like Chloe said, it's short of the actual cost that we've got data to back up, but it's a badly needed increase that we're hoping to gain leverage. The momentum, the support coming from House Human Services is a big step in the process.
And actually that I'm going to jump in on the data system because I just got information last night that Energy and Technology might not be supporting our proposal to build out the CIS data system. So this data system already exists. It's a Salesforce platform. A region's been using it. The rest of us want to use it because we've been counting numbers by hand to submit our 6-month data reports, which is great to have the data, but it comes at a cost. So this one-time use of funds would let us promulgate the data system across the state and really create a lot of efficiency. So I would say it's a little short-sighted if we don't support it. You know, I know that the state has plans to develop a data system, and CDD is working on one, and we can see how that's rolling out, which for some of you I know has been frustrating. So if that's taking that long, how long are we going to have to wait for CIS to be built onto that? Why not build a CIS data system that already actually exists, so expand it and tie it back to the one CDD is planning, which we can do because they're both on a Salesforce platform. So that's the pitch. And really, I'm hoping we can get some traction there because it's been a long time coming. So if you happen to have legislators in your regions who are on that Energy and Technology Committee, and you could do a little pitch about how it would be super helpful. Families and kids would get more services if we didn't have to count our spreadsheets and numbers by hand. That would be great. So,
and that's something you could find out from Matt or Dan if you have a question. Who of these two committees is House Appropriations or Energy and Technology who's on these committees? Is anyone from your region sitting on them? That's great data, and can support that also for our lunch dialogues.
I'm going to stop sharing. So that was a lot in a little bit of time. Any thoughts or questions folks have, or stories from your communities about how CIS is working and where you would hope we get investment in this system?
Chloe and Claire, this is so great. I just want to clarify to make sure I'm crystal clear on the advocacy details. So the ask is for the 1.6 million one time for the tech, and then the 1.8 is the identified need for annual ongoing, and truly that feels like it would meet the need, that 1.8.
Yeah, go ahead.
The $700, as Chloe and I were both saying, that's if you take the 634 on the 2018 study, you add an inflator. The advocacy group within the Alliance feels comfortable that the $700 ask would get us closer again towards realizing the potential of this system, as opposed to we're happy to see that there's progress to getting us a recommendation for half of those dollars, but that's half of the ask.
Got it. And then for the IT system, just so I'm crystal clear, it would live within state government. It already does. You just want to promulgate it throughout the state?
So actually it lives at the Family Center of Washington County.
Okay.
So they developed it a few years ago when they saw the writing on the wall that the next iteration of the CIS database wasn't actually going to make it. And so there are 3 or 4 regions, ours being one of them, that are piloting it. So we're building onto their database. And so if this goes forward, we'd have to figure out a way with ADS, the data system folks at the state, and CDD to tie it all together. But it's, you know, it's in the cloud, it's secure. And I think that it would just be a matter of making agreements about, but the state could access the data, right? So everybody, all of us would be end users to this data. There would be permissions for it, but it would all be right there so that the state could use it too. So, but in terms of who owns, like, where does it live, that technical piece, that would take some, you know, figuring out memorandums of understanding, blah, 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 blah. So does that make sense, Allie?
Yes, it really does. So in other words, though, you're sort of saying, look, if you give us the money, we can actually do the work.
Yeah.
And then it's the Salesforce, so you can tie it back and sort of take it, or at least create the doors into it that are needed. So you all would just be doing the work efficiently and quicker, and getting sort of the end product done.
Yes, and having that kind of public-private partnership there, it's already demonstrated. I think we've had it for at least 5 years, if not longer, in place. And it's an Exponent case management system on Salesforce platform. And we're not the only state that's using Salesforce for case management software program. When we selected Salesforce, they already had demonstrated success in a number of other states doing case management database building. So this is an innovative way for the state to partner with community that has funding, one-time funding actually available, which is not typically the case.
Yeah. So I'm hoping. Any other thoughts or questions? I forget how long we're going, but I think we're bumping up against time a little bit.
I think we have till 11:50 or 11:55. I'm not sure.
No, I think it's 11:40.
Yeah, we are
Started at 10:55.
just at time.
Well, it's been really great to share this with you. I hope it made some sense. I am totally open to hearing from anybody anytime. I'm happy to talk about CIS. So Chloe at winstonprouty.org, feel free to be in touch. And if you want talking points or why the data system is so important, I'm really happy to talk about that too. So, so that's
Here,
all.
ditto what Chloe said. Thank you all.
All right, thank you. Have a good rest of the day.
Thank you, everybody. Bye-bye.